Let's discuss the 5 transporting points. HESI points, lung 5, Chize, Cubit, Marsh. Location in the cubital crest on the radial aspect of the tendon of the bicep. How to find? By slightly flexing the forearm, the bicep tendon becomes more visible. Lung 5 is located on its radial aspect in the cubital crest. Also located in the area of the cubital crest are P3, ulnar to the tendon, heart 3 at the ulnar end of the cubital crest, and LI11 between the radial end of the cubital crest and the lateral epicondyle. Needling vertical 0.5 to 1 tune. Needle with the arm slightly flexed. Use a bloodletting for heat disorders. Caution, avoid cubital vein. Actions, indication, clear heat in the upper burner, descends the lung chi, regulates the water passages, opens the channel and luo connecting vessels, alleviates pain. Special features, HESI point, water point, sedation point, distal point for the lung, local point for the elbow, use bloodletting for disorders of the skin and lung due to excess and or heat. This point is mostly used for interior patterns of excess nature characterized by heat in the lungs with such symptoms as cough, fever, yellows, sputum, and thirst. This point would be applicable at the chi level, second stage of the 4-level pattern identification characterized by full interior heat in the lungs. Can also be used in chronic condition characterized by retention of phlegm and heat in the lungs, such as may happen in chronic bronchitis. In this case, it would be combined with stomach 40 and other points to resolve phlegm. In cases when lung heat has injured the body fluids, lung 5 can be combined with kidney 6 to clear the lungs and nourish yin. In connection with fluids, the explanation of the acupuncture points says that lung 5 can be used for sadness and crying deriving from dryness of the lungs, and this point can treat the symptoms by reinforcing the point to promote water. It is also an important point to use in the second stage of whooping cough characterized by phlegm and heat in the lung combined with lung 10, stomach 40. However, lung 5 can also be used for interior patterns of an excess cold nature, with retention of cold phlegm in the lungs manifesting with such symptoms as cough with profuse white sticky sputum and chilliness. In all these cases, this point would be needled with reducing method. Lung 5 also has an effect on the bladder in opening the water passages and facilitating urination. It is therefore used for enuresis or frequent urination. The explanation of the acupuncture point says that this point should be reinforced to affect the bladder and kidneys in cases of enuresis. However, this point can also be used for retention of urine caused by obstruction of the lungs by damp phlegm, preventing lung chi from descending and from opening the water passages in the lower burner. In this case, lung 5 would be reduced and would be combined with such points as spleen 9 and ren 3. Finally, lung 5 relaxes the sinews of the arm along the lung channel and can be used in painful obstruction syndrome or paralysis of the arm and or shoulder when the patient is unable to raise the arm. The ABC of acupuncture states when the arm cannot be raised to the head or there is pain in the elbow, use lung 5. The illustrated manual of acupuncture point, as shown on the Brunsman, says lung 5 can treat when painful obstruction syndrome of the elbow and inability to raise the arm. Mostly for excess patterns, resolve phlegm and clears heat from the lungs, opens water passages and benefits the bladder, relaxes the sinews of the arm and shoulder. water point, sedation point, hesi, antic-autumn point. As the water point and one which regulate the water passages, lung 5 can be used to expel or dry out excessive phlegm, fluid, or dampness in the lungs. Conversely, if there is too little water present in the patient may feel parched with a dry cough, bronchitis with much mucus, or rigid in mind or spirit. Helpful when the patient is depressed, weeping, or sorrowful. Dreams of metal object within water can indicate the need for this point.